So I'd like to start by thanking you for attending today. My talk today will delve into some of the research that I and my team based here at the School of Public Health and Health Sciences have been conducting over the past 8 years. Hard to believe it's been 8 years, but time flies when you're having fun. Why is this not advancing? Okay, maybe I need to do this. Okay, so just a little bit of background about myself. As you heard, I've been a gambling researcher since 1985, when I was hired to evaluate a treatment program, a demonstration program for problem gamblers that was funded by the state of New York. And my first day on the job, I was handed a 2-page bibliography and told that this represented the entire published literature on problem gambling, which seemed incredible since the state of New York at that time was spending $750,000 a year to treat people. So I took the advice of Anselm Strauss, who was my PhD advisor in sociology, to study the unstudied. And that is what I've been doing for the last 35 years. I should mention I've done a lot of research around the world, and I joined UMass Amherst in 2013, and you can read a little bit about me on the website. So in 2007, the Mashpee Wampanoag tribe received federal recognition and announced its intention to pursue Class 3 casino gaming under the provisions of the Indian Gaming Regulatory Act. A year later, then Governor Deval Patrick announced that Massachusetts would pass legislation establishing commercial casino gambling. However, as is often the case, it took quite a few years for a bill to actually be passed. In addition to the possibility of a tribal casino, legislators were anxious to recapture the flow of Massachusetts dollars going to Connecticut casinos, which was estimated at about $1 billion a year in 2010. By the time the bill passed in 2011, legislators were grappling with the effects of the Great Recession, and jobs were a dire need. The Expanded Gaming Act, as I mentioned, was passed in November of 2011. It allows for 3 resort-style casinos to be built in 3 geographically distinct regions of the state, as you can see on this map. There's no more than 1 casino allowed in each region, and the act allows for 1 slot parlor, which is only slot machines and no table games, that is not geographically restricted. As I mentioned, casino legalization took several years to come to fruition in Massachusetts. And one critically important result is that Massachusetts legislators actually had time to look around and investigate best practices internationally in relation to this industry. There are a number of elements in the Massachusetts legislation that I believe are particularly important and which I've highlighted in this slide here. Sorry, I'm trying to see what, okay. So regulators, in contrast to many other jurisdictions, regulators in Massachusetts are required to give equal importance to establishing a viable industry and minimizing and mitigating negative impacts. That is not the case in almost any other jurisdiction in the US, and it's only the case in a few other jurisdictions internationally. Another key component of the act is that host communities are given a very strong voice to determine whether their community is going to get a casino or not. Another key component is that problem gambling is framed explicitly in the Expanded Gaming Act as a public health issue. There's also language in the statute that gives a central role to research, or as we call it in public health, surveillance and monitoring, to enhance responsible gambling measures and to minimize and mitigate problem gambling. And then finally, and I think this is probably one of the most important reasons that I'm standing here and talking to you about this stuff today, is that the Act actually has provisions for funding to fund the research and to provide services for problem gamblers and their families. So this map shows where the licensed casinos and slot parlor are located in Massachusetts, along with their host communities and the Gaming Commission designated surrounding communities. So the licensees are Encore Boston Harbor in Region A, MGM Springfield here in Region B, and Plainridge Park Casino, which is the slot parlor adjacent to a harness racing track in Plainville, Massachusetts, down at the southeast border. So in addition to authorizing casinos, I mentioned that the Expanded Gaming Act is unique in the US in requiring the Gaming Commission to establish a robust research agenda, and that's laid out in Section 71 of the Act. The research agenda has three important components, including research to understand the social and economic effects of casinos in Massachusetts, a baseline study of problem gambling and existing programs, and then independent studies in a variety of different areas, including etiology and epidemiology, which is actually language that I managed to insert through the good graces of our state senator at that time, Stan Rosenberg. So this slide gives you an idea of how the project is organized. The overall project is overseen by an executive team, and it has two main components, looking at social and health impacts on the one hand, and economic and fiscal impacts on the other. There are specialized data collection, and analysis tasks associated with each of the arms of the project. And then there are some data collection efforts, such as the patron surveys that we conduct at each of the casino properties that are done collaboratively across the social and economic teams. In 2019, when the study was reprocured, we added an important new component to the study, community engagement and knowledge translation. This component includes key informant interviews and focus groups to help understand concerns at the local level. But additionally, we have and will continue to provide assistance to community organizations in the host and surrounding communities with their research needs. So this slide provides an overview of the areas that the social and health team focuses on, which are impacts that are primarily non-monetary in nature. We rely on many different sources of data to assess social and health impacts. Primary data includes a number of baseline surveys, targeted surveys in the host and surrounding communities, and as I mentioned, key informant interviews and focus groups. We also collect and analyze a lot of secondary data from different government agencies in Massachusetts, as well as federal agencies. And then we also have crime data that's incorporated into our project based on work that's done by the Gaming Commission's own crime analyst. This slide provides an overview of the areas that the economic and fiscal team focuses on, which are impacts that are primarily monetary in nature. And again, we rely on a lot of different sources of data to assess these impacts. We actually get directly from the operators information about the wages and benefits that they pay to all of their employees and money that they spend buying goods and services from vendors in Massachusetts and elsewhere. We also collect a great deal of administrative data from the Gaming Commission, and we get secondary data from other government agencies in Massachusetts, as well as federal agencies. So I've already mentioned some of the concerns that people had about casinos prior to the passage of the Expanded Gaming Act. The ones I mentioned already included recapturing money that Massachusetts residents were spending at Connecticut casinos and the need for jobs in the wake of the recession. Interestingly, in 2013, The organization now known as the Public Health Institute of Western Mass received funding from the Robert Wood Johnson Foundation and the Pew Charitable Trusts to conduct a formal health impact assessment to provide input to the Gaming Commission regarding community concerns about a casino in Western Mass. This slide identifies some of the key concerns that residents of Western Mass and the organizations serving them expressed with regard to a casino coming to Western Mass. What's really unique about our situation here is that Sigma provides a unique opportunity to collect and analyze data related to these community concerns and to assess whether these concerns were in fact realized. So the rest of my presentation will focus on the results of research that my team and I have carried out in Springfield and here in Western Massachusetts. I'm going to focus on results from 4 separate investigations that we've done in Western Massachusetts in the wake of the opening of MGM Springfield. In 2 reports published in 2018 and 2019, we released results from similar activities focused on the slot parlor in Plainville, Massachusetts. And this year and next year, we'll be conducting similar data collection and analysis activities focused on Encore Boston Harbor in the greater Boston area. All of our reports, as well as recorded presentations, slides, and fact sheets are available on our Sigma website, and I'll share that link with you at the end of my talk. Since my focus today is on MGM Springfield, I want to start by sharing some information about the property. It has about 3,000 slot machines and about 100 table games, as well as a separate poker room. The property itself is located directly in downtown Springfield and is quite large at 850,000 square feet. There is a 250-room hotel on site, as well as convention space, restaurants, and other dining options, and a variety of other amenities, including a bowling alley, an arcade, and a movie theater. The fact that the casino is located right in the middle of downtown Springfield gives it a very unusual outward-facing facade to encourage foot traffic between the property and the rest of the downtown. And for any of you who have visited casinos in Las Vegas or elsewhere in Detroit, for example, urban casinos tend to just be sort of big boxes with no windows, and you go in and you don't come out until you finish spending all your money. So the model of the casino in downtown Springfield is deliberately intended to be somewhat different. So the first study I want to share with you is some results from the patron survey at MGM Springfield. We conducted it in 2019, 1 year after the opening of the casino. I want to start by explaining a little bit about the methodology that we developed for these patron surveys, because they're not your usual intercept surveys where you just, like, anybody that wants to stop, you have complete a survey. We have very rigorous methods to capture a representative sample of the patrons. We wait about 6 to 12 months until after the opening so that the patronage will settle. In the past, we've conducted 2 waves of data collection to test for potential seasonal differences. We collect data on 8 different days with 6-hour data collection periods each. We sample peak and non-peak periods. We sample weekdays and weekends, and we sample afternoon and evening. We have survey teams at multiple exits, and we approach every 6th patron exiting, record the demographics of refusals for collective weighting, and at the end of the survey, for those people who complete, we give them a $5 gift card. So the patron survey at MGM Springfield, done in 2019, we collected almost 1,000 surveys and we achieved a 21.2 response rate. This slide presents information about the geographic origin of the patrons. You can see that most of the patrons, about 60%, are from Massachusetts, with 2/3 of them from Springfield and the Gaming Commission's designated surrounding communities. The other 40% of patrons are from out of state, with most of those folks coming from Connecticut. Patrons are asked about their gambling and non-gambling activities and spending in the casino, as well as activities and spending outside the casino. This slide shows you that 16% of the patrons did not gamble at all, suggesting that gambling is not the only factor drawing people to MGM. However, slot machines are the most popular gambling activity, while table games are substantially less popular. And it's important to note that the Expanded Gaming Act requires casinos to sell lottery products on site, but only 2% of the patrons that we surveyed actually purchased lottery products on site during their visit. Nearly 3/4 of the patrons spent money on non-gambling activities at the casino, with most of this on food and beverage, and half the patrons spent money outside of the casino. We assume most of that spending is in Massachusetts on their way to the casino or anticipated as they return home. And finally, we asked patrons about their interactions with GameSense, which is another piece of statutorily required responsible gaming or gambling initiative. GameSense kiosks are actually located within each casino, and they're staffed by what are called GameSense advisors. And as you can see, almost 1/5 of the patrons had visited the GameSense kiosk at MGM, and about 1 in 10 had spoken with a GameSense advisor. Oh, I always forget that this slide is animated because it's from the economics team. So I want to shift now to discuss another component of the project, which is the new employee survey. This component was originally intended to be a census of all the people hired by the casinos to understand their employment history prior to taking a job at the casino and how their casino job was expected to affect their economic situation. However, it proved difficult to get a census of all of the employees at MGM and Encore because of the many thousands of people that they hired just prior to the opening of those two large properties. In the case of MGM, we were able to collect data from about 60% of the new employees at MGM in that first year of operations. And we were able to go back and determine that the survey data was representative of the larger universe of new employees. I just want to mention that the actual survey is administered by the Gaming Commission and is considered administrative data that's then provided to the economic team for analysis. And I won't go into the reasons for that, except that it got us in trouble with the IRB early on. Let's see. Did I not change the slide? Ah, here we go. Okay. So one important goal of the Expanded Gaming Act, as I've mentioned, was to provide jobs, particularly to people who were unemployed. And this slide shows the previous work history of the new employees at MGM. You can see that 10% of these new employees had been previously unemployed, with more than half of these individuals having been unemployed for 12 months or longer. A very small number of the previously unemployed, about 27 people, were actually first-time job seekers. So this job was their entry into the labor force. But over half of all the formerly unemployed workers had had a full-time job at MGM, had a full-time job when they were hired at MGM, and 42% were hired to work part-time at the casino. So this was definitely an improvement for those folks that had been unemployed. Now, beyond wages and salary, providing employees with access to benefits is an important aspect to providing good jobs, since benefits can increase people's economic security. Benefits include things like health insurance, saving for retirement, and receiving paid time off. Most employees at MGM Springfield earn benefits, the most common being health insurance and paid time off. What this slide shows is that over 1/3 of the new employees at MGM did not have any benefits in their previous jobs. The most common forms of benefits that new employees at MGM received at their previous jobs were health insurance and paid time off. Retirement benefits were much less common. And while it's not shown on this slide, once in their casino jobs, employees' receipt of benefits improved across all of the different employee types and categories, meaning part-time and full-time, as well as hourly and salary. 75% of the new employees reported receiving health insurance, 72% reported receiving paid time off. Retirement benefits were still lower than other types of benefits, but more employees reported having them at the casino than they had with previous employment. So next, I want to present some results from a third component of our study, which is our analysis of MGM Springfield's first year of operations. This exercise depends on the use of econometric modeling, which takes inputs on employment, expenditures, gross gaming revenue and taxes, as well as the patron survey, to understand the economic impact of the casino's operations within the state. This map just shows you the regions that were used in the economic impact model. The work was done by the economic and fiscal team based at the Donahue Institute. And although Donahue does a great deal of economic impact work, this project is unusual for them due to the high quality of the data received from the Gaming Commission, as well as directly from the casinos, who provide us with their actual employment and expenditure data. This slide shows that MGM Springfield began operations with 3,072 employees. The casino completed its first operation with 2,122 employees, which represents a 31% decline over the course of the first year. But just for context, the other casino that we have studied in this way so far, Plain Ridge Park Casino, also saw their employment decline in the first year, although that was only by 11%. And it has to do with sort of the big exciting period when you first open a property like this, and then employment tends to reduce somewhat as visitation reduces. This slide shows the payments that MGM Springfield made to third-party entities. 3/4 of this money, as you can see, went to private sector vendors. So that was all the things that the casino bought to be able to run its business. But interestingly, 1/4 of that money actually went to various government entities, both at the federal level, but even more importantly, within the state and at the local level. The table does not include taxes that the casino paid on gross gaming revenues, since these are actually recorded separately. So just to clarify, MGM and Encore Boston Harbor both pay a tax on their gross gaming revenues of 25% to the state of Massachusetts, and the slot parlor pays a tax of 49% on its gross gaming revenues. So basically 50 cents on the dollar from the slot parlor goes to the state. And interestingly, as a consequence of that tax rate and the longer time that it's been in operation, the slot parlor actually has generated more gross gaming revenue tax for the state of Massachusetts than either of the two much larger and more diverse properties. This slide shows how the economic team uses data from the patron survey to understand different types of spending. It shows that almost 80% of the patron spending on gambling at MGM Springfield was considered new spending, even though it came from a somewhat smaller portion of the respondents. What that means is that this is money that was coming either from Massachusetts residents who told us that they would have otherwise traveled out of state to gamble, or it was coming from out-of-state residents who would not have traveled to Massachusetts without the casino being available to them. About 20% of the patron spending on gambling was considered reallocated spending, which means that it was money that Massachusetts residents told us they would have otherwise spent on other goods and services in Massachusetts. The final investigation that I want to share with you today focused on changes in gambling attitudes, behavior, and problem gambling prevalence after MGM Springfield opened. We completed 2 population surveys in Springfield and surrounding communities. The first was done in 2015, shortly after the license was granted to MGM by the Gaming Commission, and the second was done in 2019, about a year after the casino opened. And the purpose of this investigation was to provide vital information for the development of prevention and treatment programs in Western Massachusetts. This slide provides some details of the methodology employed in the 2 surveys that were carried out in Springfield and surrounding communities. As you can see, there were some differences in the 2 surveys that are mostly due to our decision to use targeted lists in 2019 to increase the proportion of minority respondents in the sample. As a result of this decision, the response rate declined, but we were successful in recruiting more minority respondents, as the increase in completing in Spanish clearly shows. This slide shows changes in overall past year gambling participation, as well as past year participation in several specific formats among residents of Springfield and surrounding communities from 2015 on the left, I think that's the left for you as well, and 2019 on the other side. There was a slight increase in overall gambling participation among respondents or within the samples in this period. Past year gambling at out-of-state casinos, as you can see, changed very little, but there was a significant increase in any casino gambling in the past year, from 23% to 37%. This change was driven by the substantial increase in the proportion of residents of Springfield and surrounding communities who gambled at both Massachusetts and out-of-state casinos in 2019. Beyond past year overall casino gambling, there actually were no statistically significant changes in gambling behavior among residents of Springfield and surrounding communities between 2015 and 2019. We also looked at differences in overall gambling, lottery participation, and casino gambling by gender, race, ethnicity, age, educational attainment, and income level. And again, we found no significant changes in overall gambling or lottery participation by any of these variables, with the exception of overall casino gambling. The final issue that we looked at was problem gambling. This is a particular concern because one of the main negative social impacts of expanded gambling availability is assumed to be an increase in problem gambling. But as this slide shows, there was no significant change in the prevalence of at-risk and problem gambling between 2015 and 2019 among residents of Springfield and surrounding communities. Replication surveys that examine changes in problem gambling prevalence in the same jurisdiction over time provide a direct test of what's called the exposure versus adaptation hypotheses. Our findings from the surveys in Springfield and surrounding communities, similar to our findings from the Plainville region, suggest that the Massachusetts population is far from naive when it comes to casino gambling. States surrounding Massachusetts, including Connecticut, New York, and Rhode Island, have had casino gambling for decades prior to the introduction of casino gambling in Massachusetts. And following their initial exposure, any effects in the population may have abated over time, even in a population that experiences a recent and significant local gambling expansion. In our view, the findings from this component of the study suggest that population adaptation has already occurred, as no increased risk of harms associated with casino gambling in Massachusetts was identified. However, there are some concerns related to how particular demographic groups may be affected going forward. One group of concern is individuals with lower education. Another group of concern is individuals with household income under 50,000. Both of these groups may be vulnerable to experiencing gambling problems because the location of MGM Springfield has given them access to a type of gambling with which they have relatively little prior experience. I'd like to end today by discussing some of the things that we have learned about the introduction of casino gambling in Massachusetts. You may recall from the beginning of my talk that some of the biggest issues that concerned people about the introduction of casino gambling in Western Massachusetts were recapturing money that Massachusetts residents were spending elsewhere at other gambling venues out of state, creation of good quality jobs in the wake of the Great Recession, and possible increases in the rate of problem gambling, in crime, and in traffic. So here's on this slide a summary of what we've learned with respect to those issues in Western Massachusetts. We've learned that recapture does seem to be working. We've learned that most of the patrons at the Western Massachusetts casino are primarily local, with some out of state but regional folks coming. The number of jobs at the casino is lower than projected, but the quality of the jobs is generally good. The casino is providing a high level of government revenue. Casino participation has increased, but this is primarily due to people adding a local amenity to their existing gambling repertoire. Problem gambling has not increased, and although I haven't presented this data because it's not actually part of the work that our team is doing, the Public Safety Impact Report that Christopher Bruce, the Gaming Commission's crime analyst, presented on the first year of crime impacts and public safety impacts, found that the casino's overall effect on the region's crime numbers was mild, and that the increase but that there was an increase in traffic collisions and traffic related calls for service in the year following the opening of the casino. My final slide is that we are looking forward to a very, very busy year ahead. We have a follow-up general population survey that went into the field on Friday, and I actually have been fielding calls from eligible respondents all day today and yesterday. So thank you for your calls, and thanks for completing if you get one of our surveys. We will be conducting in February the Encore Boston Harbor Patron Survey. We have a report coming up early next year that will be published on the impacts of COVID on casino operations. For those of you who follow COVID activity, you may be aware that the casinos were actually closed completely for 4 months. And when they were reopened, they were required to be first at 25% capacity and then at 40% capacity. What's interesting is that as soon as they were allowed to reopen, even at 25% capacity, their revenues shot right up, back up to where they had been before the pandemic. So I'm sure there's some news that's going to be coming out about that in, as we analyze the data. We are paying a very close attention to the legalization of sports betting and online gambling in Massachusetts, although we have been told that we are not permitted to lobby with regard to specific legislation, but we certainly have some strong ideas about how sports betting should be made available, and also how prevention needs to be put in place to prevent collegiate athletes and college students in particular from getting into trouble with sports betting. And then finally, looking out to 2023, we have a very large integrated report that we're going to probably start working on in the next 6 to 9 months. And that will summarize all of the impacts of all 3 casinos over all the time that they've been open in Massachusetts. And here's the last slide that I promised you. This is where you can go online to see what the study is all about. As I said, under the publications tab, We have lots and lots of materials. And of course, if you have questions or any, something that's not answered with all of these materials, send me an email and I'll probably answer you. And now I'm going to stop sharing. Okay. Hopefully there's some questions. I see 5 things in the chat. I'm not hearing, nobody was hearing anything. So
can I ask you a question while you're waiting for other people to answer?
Yeah, absolutely.
So, and maybe you mentioned it, but I don't remember picking it up at the beginning. Did the legislation actually earmark the revenue that's being made from the casinos in order to sort of mitigate any kind of public health or even sort of problem gambling or violence? I'm just thinking things that are usually correlated with gambling.
Yes. Yes. So 100% of the the gross gaming revenue tax is allocated to different pots, and 5% of the 25% of gross gaming revenues that is generated by the 2 resort style casinos actually goes to a new fund that was set up specifically called the Public Health Trust Fund, which is there's an agreement between the Department of Public Health, which manages that fund, and the Gaming Commission, because the Public Health Trust Fund is supposed to pay for the research agenda, the responsible gambling initiatives that the Gaming Commission operates, and for all of the prevention and treatment work that the Department of Public Health is doing. So it's a 25-75 split. And the estimate is when all 3 of the, when all 3 of the operations that are currently in place now are up and running, there's about $15 million that flows into the Public Health Trust Fund for addressing problem gambling issues. Okay, let's see if anyone else has some questions. So from Laura Vandenberg, can you talk about smoking and gambling? Is it allowed in Massachusetts? So I'm looking at Laura because she's here in person. The casino law in Massachusetts is actually fairly unique in prohibiting smoking within the casinos. There are quite a number of tribal casinos around the country that also prohibit smoking, and quite a few of them that do not serve alcohol. So Massachusetts is unusual because it's a commercial casino operation that is not allowed, that people are not allowed to smoke indoors. I can assure you that they all have provided spaces for their customers to go if they want to smoke, but both the people that work there and actually quite a number of the patrons have expressed to various entities that they really like the Massachusetts casinos because there is no smoking allowed. Paige Schaefer asked, how was problem gambling defined? Was it using the DSM-5 criteria? And then there's a separate question about the traffic data. We used an instrument called the Problem and Pathological Gambling Measure to assess problem gambling in our surveys. We know how the PPGM and the DSM-5 and DSM-4 criteria operate together, but we did use this measure of problem gambling that takes into account that people can experience loss of control over their gambling and not necessarily experience harms, or alternately, people can experience harms without having lost control of their gambling. So those are the 2 essential components of the construct that you're trying to measure. And then the question about the DUIs, the DUIs were included in the work that Christopher Bruce did. I'm not as familiar with that material as I am with what we've been doing, but all of Christopher Bruce's reports that have been published so far are posted on the Gaming Commission's website. And so just look for the 1 year Springfield, MGM Springfield report, and you should be able to find an answer to that question. And
Thank
then
you.
Rebecca asked, sorry?
Thank you for your responses.
Oh, sure. Rebecca Hunt asks, how has your research in Massachusetts compared to your time in New York? Well, my time in New York was interesting. I was a very new, newly fledged PhD, and this was my first job out of graduate school. And just to confess, I am not a PhD in public health. My PhD is in medical sociology with a specialization in qualitative measures. And so when I got dropped into this job, what I didn't know anything about was survey research. And I employed my interviewing skills and learned how to conduct surveys by interviewing a bunch of statisticians and survey researchers who I was fortunate enough to work with. But I was on a very steep learning curve. And then I was, as I was, learning how to conduct surveys and learning about gambling, which I'm not personally a gambler, but I'm interested in people who gamble and why they do that. But I happened to sort of have gotten into the field at a time when it was expanding dramatically. And so, as a woman and a female academic, I hate the phrase I was in the right place at the right time, but I literally was. I had been doing work on gambling surveys for about 3 years. And then the number of casinos in the country exploded because of the passage of the Indian Gaming Regulatory Act. And so suddenly there were like 25 or 30 states that were like, well, the tribes are going to get casinos, so we're going to get commercial casinos. And suddenly everybody wanted to do a prevalence survey to prove that, they had done the right thing, even though people thought they had done the wrong thing by legalizing casinos. And so I just was like, people would call me up and say, I understand you know how to do prevalence surveys of gambling. Can you come do one in Iowa? Can you come do one in Montana? Can you come do one in North Dakota? And at first I was like, yeah, sure. And, like, how much do you have? And they would tell me, and I would go, okay, let me see if I can find someone who can collect the data, because I had the questionnaire. But probably in 1997, I was like so busy with these little projects that I said, I need to figure out like what this really costs and then tell people what I need to like make it work for me. And my husband, who's an engineer, helped me build my first budget. And we ran the numbers and I was like, no one's going to spend that much, 150,000 on a gambling survey. But it was a competitively bid thing. And it was the first project I had actually submitted a competitive bid for. And much to my surprise, I got the project. And then, like it just kept coming and coming and coming. And when I got the Lifetime Achievement Award from the National Council on Problem Gambling, the executive director actually made a joke, which was a true joke, that at one point in time, I was responsible for the majority of prevalence surveys of gambling and problem gambling that had been conducted in the world, which I'm no longer, thankfully, not that, but I have done well over 100 problem gambling surveys. So I guess my research in Massachusetts is much more broad ranging. And it's really been such a privilege to be able to look at all of the impacts. I know a lot about problem gambling, but that's because that's kind of where I got slotted into. But it's so interesting to look at the economics. It's so interesting to understand the job creation issues and just sort of the broader picture. So I feel really privileged that I was able to compete successfully for that project. And I've been able to be doing it for, 8 years and another 4 years at least. I mean, the other thing that's different about my time here rather than compared to York is that, in New York, it was just me, like sitting in an office doing a survey. And now it's like, I have a really wonderful team of folks who do all of sort of, the budget management, managing the issues with the university and, managing the bureaucracy. And I get to like sail into aisles and do a talk, but it's because I'm standing on the shoulders of all of these wonderful people that really help, get the work done. And so I really want to say that the biggest difference is that I have a whole team, and it's not just me pretending that I'm an expert. Okay. Yes, it is. Rebecca says that's a fascinating career path. Yeah, I think, and maybe is it time to wind up? I don't even see a clock.
Yes,
It is.
5:56.
Oh, okay. So it's 5:56. I get one more bite at the apple. I want to say that I came to UMass with the strong possibility that I was going to get this project. And it was a once in a lifetime legacy building event. But what I didn't realize was how much of a home I was going to find at the School of Public Health and Health Sciences. And it really has been a privilege every day to be able to, work not just with my team, but with the other faculty, with, some of the students that have, especially the ones that have worked on the project. But I just want to say to everybody, you never know when the next great thing is going to happen. And sometimes it's something really terrible and it changes, sort of what your priorities are, but sometimes it's really great. And it's really important to kind of keep your eyes open to the possibilities, because there are a lot of them and you just have to pay attention. So thank you.
What a great comment to end on. Thank you so much, Rachel. Appreciate it.
Thank you.